Hello, I'm Dr. Rumana Dowla from Bangladesh. I'm a palliative medicine consultant at United Hospital. Today, we are going to learn about communication skills in palliative care. And at the end of this lecture, you'll be able to understand the concept and components of communication, know the steps in breaking bad news to a patient with an incurable disease using spikes, and be aware of the barriers in communication during with the patient. Here I am sharing a video of empathy and hidden thoughts of patients. I would like you to go through it when you have time after the lecture, and also think about how you feel while watching the video. So, what are the goals of communication? When we communicate, we want to share information. And by sharing information, we reduce uncertainty. And we also build trust between the patient and the caregiver. And of course, with us as well. Patient, caregiver, and the nurse or doctor also has a good relationship with good communication. And we can also explore patients' worries. We help patients' decision making of their medical treatment, and it improves the patient and family's satisfaction with care. And communication is best done early in the time and during the treatment, prompting early sensitive discussion between patient and their family members, such as about illness, managing care, death and dying related issues. Maybe not too early, but when it's right time, because if we delay, it may be too late. And also, better communication earlier, if it's done with the key family members, it reduces conflict among the family members, also amongst doctors, nurses, and family members. Also, we need to start having the conversation early with the patient about their worries, their anxieties, early in the diagnosis when there is life limiting illness. But there are, we understand, barriers in clinical practice. For doctors, nurses, and other health workers, there's time constraint. Um, Patients are not aware of their rights in treatments during decision, in decision making for the treatment related issues. And clinicians are uncomfortable talking about end of life issues. That is another barrier. A good communication, you know, creates rapport between patient, their families, and also the other health workers around. As you saw in the picture, that was in a patient's room with their family members. And consequences of poor communication is lack of trust in caregivers. Patients stop seeking care, patient not revealing important information because they don't feel comfortable or they don't trust the caregiver. And increased patient distress can give rise from those poor communications. And then patient may end up choosing ineffective care, sometimes, alternative medicines which are not effective for the patient. And who is a good communicator? So, a good communicator will have knowledge about the patient and all the facts related to the patient and the disease, or whatever the patient's nature of the disease is at that point. And someone who speaks clearly, speaks confident, and maintains confidentiality. Someone is who is sincere, non-judgmental, and accepts the patient as they are, and someone who maintains non-verbal communication key points like eye contact and the body language is correct. These are the points that we have to keep in mind if we want to be a good communicator. This is an interesting research I wanted to share with you. The psychologist Albert Merman did this research, and it's quite well known. Almost 90% of what we say, uh, the amount that what is retained with the patient is the non-verbal communication, such as voice, tone, body language, and posture. Those are important areas because that is what the patient remembers, and only 7% of are the spoken words if we look at the elements of personal communication. So here it's very clear what we say. Yes, those are spoken words, but how we say it, and what is the situation around it, around the communication, it's very, very important. So we need to be a good listener while communicating. When we ask a question like, what is your biggest concern at the moment? Or what bothers you most? We must give time for the patient to talk. And we mustn't assume that the patient does not want to discuss certain things. We must keep it open. Also, during the conversation, we have to allow silence and listen for the hidden questions. And active listening is also important. When the patient is saying something, we have to nod, we have to maintain eye contact, we have to use phrases like right, all right, is that so, small little phrases which makes the patient feel that yes, someone is listening and paying attention to what I'm saying. So, three communication skills which are very important. The key communication skills would be active listening, using silence, and non-verbal behavior, which we just saw how effective it is. And what do we mean by active listening? Occasional nodding, taking notes, not too much, just a little bit. So the patient feels okay. She's really, giving this importance. And we should avoid any interruption. Mobile should be on silence. Others should be told not to interrupt the conversation. The door should be shut. And we have to encourage the patient to speak, and like as we just discussed, that we have to use small phrases like in Bengali we can say acha tarpor, then what happened, things like that, and maintain the non-verbal good posture and eye contact. And we have to also sometimes summarize and paraphrase, so that patient we are confirming that what we have heard and understood, is that actually what the patient said. So it's very important to do all the above to maintain a good communication. And using silence is very, very important. And non-verbal communication, once again, is the body language, posture, eye contact, facial expression. If we have a grim face and whatever we say, patient will feel uncomfortable. So we have to be receptive and keep a kind face, so just so that patient feels that someone is being nice to them and is accepting them as they are and is interested in their worries. So another issue we need to think about is how much information should we give the patient? We are sometimes not very good at predicting what patient wants. And if the problem with it is if we don't inform the patient adequately earlier in the process, patient may end up taking too much, choosing aggressive treatments even when they don't really need it, when it is inappropriate and it just drains them financially. So we have to understand their goals, understand and know about their exact situation of the disease process, and guide them accordingly and help them decide what they want. They may not want to take all the aggressive treatments. They may want to go back to their villages. We have to also understand and, um, you know, Not say that, this treatment is available and that's it. Don't give them option. They may just want to take one or two steps and then they may not want to continue. There may be many other options for the patient. We have to give them the chance to share with us. And when they're stressed, whatever we say, 50%, 40, 50% of the information is lost. They forget. So we have to call them again if possible and discuss comfortably all the details, not just in one occasion. And patient, when they feel they're understood, that someone has listened to them, they're more prepared to accept the clinician's recommendation. And also, we need to give them time to take the right decision. So here's a case I'm sharing so that you can go through it and think about it. 59-year-old woman who has breast cancer has been seeing you, and due to severe pain, she asks you why she's having this pain and what is the problem that she has. And she's not aware that she has cancer. And this is something we need to treat very carefully. We cannot suddenly give her the bad news. We have to talk about it very carefully and, bring out, as give her warning shots. So maybe, what do you think it is? What did the doctor tell you? Questions like this. So think about these and what will be your next step. Think about it. How will you start the conversation, and how will you tell her? Maybe you won't tell her diagnosis at that point. Maybe give her time to take in that there are some issues with her. Then later on, when she's prepared and she has someone with her, then you can break the news when she's already expecting something from us. So it's not a shock. So maybe these are the questions we can ask. What would you like to know? How much information can you would you like to take? Would you like us to share? What kind of information do you want to have? Also, how would you like this information to be shared with you by the health worker? Sort of frame it like this, or whatever is appropriate for that patient at that time. And also always give them option, if by questions like this: who would you like to have with you when you receive a news which may not be a good news? We may say that when we give you the report, would you like to have someone with you? In fact, we can also suggest that it'll be good for you to have someone with you, so we can whoever you are close to can come with you. So we did mention about spikes during breaking bad news. This is a very easy and helpful step to remember. So let's go through it. S is for setup, the staging before we start the communication. P is for perception of us, our perception, patient's perception. Invitation is that warning shot that we talked about. We can say that, um, I'm afraid this is not, we don't have a very good report. We would like to see you. So, already they have some idea. And then we can say that it'll be nice if you have someone with you. Also, we should have extensive knowledge about the patient's previous history, present disease situation, and then of course empathize with the patient. And when patient reacts or shares her response, then we need to summarize and at the end strategize. um, Talk to the patient about their goal, and we need to also help them decide on the type of treatment depending on the stage of the disease and situation for the patient. Now, if we go into little details about staging, it means we have to arrange for privacy. We have to manage interruption, turning our phone off. Maybe patient also silences her phone. Her associates should also turn off their phone. We have to review the chart, clarify all the medical facts for ourselves so that whatever we are saying, we know what we are talking about. Misinformation is dangerous for us and for the patient. um, Involve others, as I said, their family members and our other healthcare team. So, team is known to the patient and we can work together. The patient never feels left out. And patient should be comfortably sitting. We should be comfortable. There shouldn't be any barrier in between. And we should introduce everyone around the patient. And enough, we have to allow enough time for all the discussion to happen. It's not easy, but ideally, that is what we should do. Um, Now, always we need to get the information from the patient before we give information. Um, so we can all, as we discussed, that we find out what the patient knows, and we then proceed with the rest of the discussion. So again, this is another phrase to use, like we can say, "Can I tell you more about what is happening with your condition?" Patient may or may not be ready for it. Then we can schedule another appointment. And we have to have the knowledge, and we have to also check with the patient if the patient understood what is going on and what we have just informed them. And we have to also keep in mind whatever we say in one sitting may not be enough. We have to make time and probably and discuss few more times. Empathy is something that we have to show. We have to, it is usually ingrained, and we can also cultivate it, so that we observe and respect the patient's emotion and what they're going through. So when we think about goals and expectations, so we can say, what are your most important hopes or expectations about the future? We can ask, have you any unfinished business? What are the things you want to do in the time you have, when they already know that they are reaching end of life, or they don't have years to live? They may want to share what they want to do, and we can adjust the treatment goal accordingly. And when we talk about summarizing and strategizing, we can check overall understanding. Do you have any question for me? So if they have any question after we summarize and strategize, after at the end of the conversation, then we can clarify if there is any question in their mind. And we have to review the plan for the next few steps, treatment goals, and what the patient wants. And we must document the discussion in the file so that our colleagues will know what we have talked about, and it is documented, and they can work on the patient accordingly. Every time if we ask the same question, it can be very disturbing for the patient and the family members, and they may think we don't have a good communication amongst the health workers. So in small group, we can discuss what are some characteristics of good communication, what are some characteristics of poor communication. Here is another type of communication. During pandemic, we have many challenges. We have used posters to communicate to patients and everybody, the people around in this society, to be careful about health and to maintain certain norms. So this is another form of communication I just wanted to mention. This creates awareness, and also patients and people take safety measures, which helps them stay safe and keeps them away from disease and illness. Also, the other challenge we have is that we wear masks during the pandemic. We are not really geared for good communication. Patients, when we have goggles and shield, patients can't see us properly. So we can use our tone, we can use, body language in some way. It is challenging, but yes, we do address this. We do recognize the challenge. In summary, good communication is essential to palliative care. There are three key communication skills: active listening, using silence, nonverbal behavior. And Spikes, as I have shared, is a very useful guide to help us break bad news to patients and families. And there are other kind of communication. For children, we have noticed, even for adults, we've also there are many research that has been shared online, and we can find in books that art therapy, music therapy, poetry can help heal and the patient and caregiver. And here in this picture, you can see a child who had cancer is enjoying his colors, his painting, and so this is another form of communication. Sometimes they can, from their painting, you can find out what they're thinking about. So communication is very, very important in our life, and amongst families, friends, and very important when we speak to our patients and their family members. Thank you.